Welcome to all my dear student. Today I am going to discuss with you about antacid. So what are antacid? So these are the drugs which are usually alkaline substance and used for neutralizing excess acid into the stomach. So what does mean by antacid means usually antacid or become alkaline substance which will neutralize the excess of acid into the stomach of patients. Suppose the patient suffering from hyperchlorhydria. What does mean by hyperchlorhydria? Means hyperacidity, that means excess of acidic secretion in the stomach. So these drugs give relief of pain due to hyperchlorhydria. So hyperchlorhydria means excess secretion of, that means adequate secretion of hydrochloric acid in the stomach. In that case, so we can give them antacid. The giving antacid, it will neutralize the, it is mostly it has alkaline substance. So this alkaline substance helps to neutralize the excess of acid in the stomach. So it is possible to measure the efficacy of antacid in terms of neutralizing capacity. So these are the proper definition for antacid. Once again let me say about what is mean by antacid. So antacid is nothing but these are the drugs which are usually alkaline substance and used for neutralizing excess of acid in the stomach in case of patients suffering from hyperchlorhydria. Hyper means increasing the level of hydrochloric acid in the stomach in case of hyperacidity or hypochlorhydria. So it is possible to measure the efficacy of antacid in terms of neutralizing capacity. Next, it is known that the production of gastric hydrochloric acid is a continual process. It means that administration of antacid is also a continual process. So it is not possible to regard the use of strong alkaline bases as antacid because they will exert damaging effect on mucosal layer. So the action of antacid should be more or less gradual without evoking rebound acidity. Further, antacid therapy is usually of longer duration. It means that antacid shouldn't have any side effects. So you know that in our stomach secrete the gastric hydrochloric acid. So if the person become habituated with a deep fried food or some fast food, if they are taking frequently, so it means that it secretes the excess of hydrochloric acid, so that the person cause hyperacidity. So in that cases that antacid, so which help to neutralize the excess of acid from the stomach. So next, if antacid or water soluble, so these are the ideal characteristic of antacid. So if antacid or water soluble, they may be able to produce a systemic alkalosis. So that is otherwise known as neutralize the excess of acid, or which will produce a systemic alkalosis due to that of absorbable ions disturbing acid base balance of body fluid. So in case of antacid or water soluble means if able to produce systemic alkalosis because of that means due to that of absorbable ions disturbing acid base balance of body fluid, except for example water soluble antacid, or which will produce the systemic alkalosis. Example, sodium bicarbonate. Most of the antacid usually water insoluble, so that if in case of antacid become for example sodium bicarbonate, what will happen? So which will produce the systemic alkalosis because of absorbable ion disturbing acid base balance of the body fluid. So what are the ideal characteristic of antacid means the if the antacid become water insoluble, not soluble. Okay, so next antacid act on gastrointestinal tract, tract. So after being converted into soluble salts by hydrochloric acid, so the cations such as calcium, aluminum, etc. are having constipating effect. Why? Because so whereas that of magnesium is having laxative effect. So in order to overcome those problem, so the antacid may be combination with or combination with that calcium and magnesium or aluminum with the magnesium to be prepared as a antacid. Because of this reason, combination or combination of calcium, magnesium or aluminum magnesium salts are generally employed as antacid. So these combination help in overcoming constipative effect of aluminum and laxative effect of magnesium. So once again let me repeat the same. Why that you all the antacid become might be in a combination of like calcium with the magnesium or aluminum with the magnesium. Why? Because calcium, aluminum that is the cations which will having that constipating effect, whereas magnesium has the laxative effect which gives to the patient. So in order to overcome those problem, maybe antacid or might be combination with the calcium and magnesium or aluminum with the magnesium. Next, antacid give symptomatic relief from pain by neutralizing excess of hydrochloric acid. Thus, antacid find use in the treatment of ulcer by reducing pain. So, however, no method is available which could evaluate an antacid by measuring pain reductions. Okay, so antacid gives symptomatic relief from pain where by neutralizing excess of acid of hydrochloric acid. Thus, antacid find use in the treatment of especially ulcer by reducing pain. So, however, no method is available which could evaluate an antacid by measuring pain reduction. So there is no specific evaluation method to find out the reduction of pain. So next, the neutralizing capacity of an antacid expressed in milli equivalent. So how can we express it in form of antacid or neutralizing capacity in case of it is expressed in milli equivalent or MEQ of hydrochloric acid. So every antacid product must have a total neutralizing capacity of at least 5 milli equivalent of hydrochloric acid per dosage unit. Okay, so the pH of this is roughly enough to rise pH in an essentially empty stomach to 3.5. So the more potent of product is, more acid it can neutralize. So I think what is the how neutralizing capacity of an antacid is expressed in milli equivalent. So from overall points of an antacid, what is mean by antacid, why the combination therapy to be given to the patients in order to overcome the laxative and constipating effect, and what is the ideal characteristic of antacid, and what is the example for water insoluble means. If in case of antacid become water insoluble means what will happen, so that and all we discussed. Okay, this class will help you to understand the antacid and combination therapy, why the combination therapy to be given to the patients, and what is the ideal characteristic of antacid. Thank you.